So today's question is, I've been diagnosed with fibromyalgia. I have severe pain and I'm paranoid they gave me this diagnosis because blood tests, etc., came back clear. I've been referred to occupational therapy. Is there any hope for me? I wasn't going to answer this question simply because I'm not particularly confident in my knowledge on the subject. So we'll stick to the facts that I do know, limited as they are. So fibromyalgia is a medical condition, and it's characterized by muscle pain and stiffness in various places all over the body. Now, in the past, it was sometimes classified as a psychological disorder because some psychiatrists, quite a few, I think, interpret it to be a type of mood disorder or a mental disorder manifesting in physical symptoms. For example, Frederick Wolf, who's a well known American physician and rheumatologist, he has argued for many years, since the 90s, that it's not a disease at all, but rather it's a physical response to a psychological stress or trauma. However, since 2016, there has been near universal consensus that fibromyalgia is not a mental condition, but is instead a neuropathic disorder, meaning that the damage to the nervous system is intrinsic to the condition. Now, one of the characteristics of neuropathic disorders is that nerves fail to deliver messages between the brain and the spinal cord in the way that they're supposed to. Now, doctors aren't sure what the exact cause of the condition is, and although it's not a mental health disorder, its symptoms commonly also include anxiety and depression, which I suppose it's completely understandable, I'd say. If you're in pain all the time, of course you're going to be depressed and have anxiety. Now, some studies have found that CBT, cognitive behavioral therapy, can in some cases have a positive impact in terms of managing the symptoms. Nonetheless, the most commonly accepted treatments are, of course, medicines such as pain relievers or antidepressants or anti seizure drugs. Now, occupational therapy can also be helpful in terms of managing the effects of the condition and the effects that the condition has on your life by helping with things like adaptation techniques or relaxation techniques and pain management and communication techniques. But I mean, that's pretty much the sole extent of my knowledge on the subject. So I hope it helps. I know it's not a lot, but at least it's a start.